Hello and welcome to this WION Digital Summit. I hope you're all safe and doing well. The Wuhan virus pandemic has restricted in-person meetings, but restrictions do not mean an end of conversation. At WION, we believe nothing should dampen the spirit of conversation and nothing should be left out from these conversations. So we have put together this one-of-a-kind summit for you to address one of the most relevant issues of our times, mental health. At least 970 million people worldwide are suffering from mental health problems. 970 million. That's more than the entire population of Europe. And this number is 4 years old. Today, there is no estimate on how many people are silently suffering from anxiety, stress, or depression. The pandemic has added to these problems. It has made us lonelier, limited our interaction with the world, clipped our networks, and made it harder for us to access mental health care. While a lot has been spoken about and written, when it comes to the effects of this pandemic on jobs, economy, or our physical well-being, very little has been said on what the Wuhan virus pandemic has done to our mental well-being. The problem of mental health has been largely ignored by all stakeholders, and that's why we are calling mental health a silent pandemic. Today, through this summit, we aim to bring mental health to the talking table. With the help of all of you, our global audience, we will strive to destigmatize mental health. Over the next couple of hours, we'll make a sincere attempt to answer all the frequently asked questions. By the end of this summit, we hope to normalize conversations around mental health at homes, at schools, at offices, and in social circles. Joining me today are some of the most respected voices from around the world. Each of our panels today have been tailored to address issues that everyone watching this summit has faced, sometime or the other, in the year gone by. You know, it's not easy talking about sensitive issues like these on digital platforms, which I totally agree are a little impersonal. But the pandemic has left us with very little choice. The fear of contracting the virus has minimized interactions the world over and forced social distancing. What it has also done is stigmatize those who test positive for the Wuhan virus. The nature of the virus is such that patients need to be isolated, sometimes for 21 days at a stretch. And this can be really tough. And the ordeal does not end when the person gets a negative report. What we are seeing now is that many COVID patients are suffering from prolonged stress or anxiety even months after recovering from the virus. They're experiencing a kind of PTSD, or what's called post-traumatic stress disorder. To understand more about it, we have lined up a brilliant panel for you. So let's move on to the final session of this summit. We're calling it Post-COVID Panic.
It's a long road to recovery for Wuhan virus patients. Many complain of brain fog. Many report stress and anxiety. Some speak of prolonged tiredness, even loss of concentration. Is this post-traumatic stress disorder, or is it the new normal?
How are you coping with the post-COVID stress?
Session 3, Post-COVID Panic. Our dialogue partners for this session are Sharon Blady, former health minister of the province of Manitoba and founder Speak Up, Mental Health Advocates, Inc. Joshua C. Klapow, clinical psychologist and associate professor at the University of Alabama at Birmingham School of Public Health. Jefferey A. Lieberman, Psychiatrist-in-Chief, Columbia University Medical Center of the New York Presbyterian Hospital. Alison Holman, associate professor at the UC Irvine Sue and Bill Gross School of Public Nursing.
Dr. Holman, I'm going to begin with you. You have researched extensively on post-traumatic stress. What kind of mental health issues do you see COVID patients facing when they're recovering from the virus?
Well, what we're seeing in the United States is that there was a growing, at the very beginning of the pandemic, there was a growing level of acute stress symptoms, which are post-traumatic stress symptoms in their early phase, and growing levels of depression. We've also seen that there have been increases in people becoming more worried and becoming emotionally exhausted over time as the pandemic waxed and waned. So at this point, with the vaccine rolling out and more Americans getting vaccinated, we're hoping we're going to be launching another wave of our study to understand how that's impacting mental health. My suspicion is that as people begin to get vaccinated and start normalizing their lives, there will be greater ability to feel more back to, quote, normal, as we say.
Right. Dr. Joshua Klapow, I recently read a study that says that 1 in 3 COVID patients have psychiatric issues even months after being infected. Is this problem so rampant, or is it worse?
No, well, I think one of the things you have to take into consideration is the level of infection, the degree to which they were ill. As we know, COVID patients can range from minimal symptoms to hospitalizations and intubation. So some of the symptoms or some of the psychiatric symptoms are really also a function of how distressing the illness was. I think the other thing is we have to think about the risk factors and the buffering factors. So while the numbers are high, individuals with pre-existing psychiatric problems, individuals in more difficult family situations, individuals who potentially were more isolated, they're going to be at greater risk. And as was commented before, as the vaccinations are coming through, as people are getting more healthy, as life is getting back to what used to feel like more normal, some of those symptoms and some of those conditions will subside, leaving fewer and fewer individuals in need of mental health treatment.
So we hope. Dr. Lieberman, what according to you leads to these mental health problems among COVID patients? I know that we tend to see other people with a bit of suspicion with the way this virus has spread. How big of a role does the taboo associated with the Wuhan virus play here? Or is it that 14-day isolation that is a bigger contributor?
Well, I think you have to make a distinction between the acute effects of the threat of infection or the experience of infection and the social and economic disruption that the pandemic is causing, which everyone feels to some extent. It's like when you go outside and it's in the winter and you ask someone, do you feel cold? They're going to say, yes, I feel cold. That doesn't mean that they're having a mental illness or that they're suffering from stress that's going to be enduring or damaging. So everyone is feeling a degree of stress, which they manifest some symptoms of trauma-like from. They may experience it to greater degrees, depending on how close they are to either having been ill or having people in their family that are ill or having their lives disrupted. But the thing that I worry about and I see as occurring in the aftermath, the months and the years after the virus is contained, is the vulnerable individuals developing syndromal mental disorders. And that's something which is going to evolve more gradually. It's not going to be an immediate effect.
Sharon, Blady, a lot of people recovering from the Wuhan virus are reporting what's been called a brain fog. You know, people are facing difficulty recalling things, focusing on their day-to-day work. Could you help our viewers understand what a post-COVID brain fog really is and why does it happen?
Well, I think in some respects the best way to look at it is if you think about how we go into fight or flight mode and what shuts down and what keeps us going. And so it's that same kind of thing where rather than being in an immediate fight or flight mode, we've been in perpetual stress. And it is that kind of thing where we start to shut down in particular areas and we do feel foggy. And the one thing to recognize at this time is that this is normal, and I do very much agree that there are going to be lags. And in the same way that we had to get used to this dynamic and what this has done to our cognitive ability, to our mental health, we're going to have to transition out again into whatever the new normal is. But it's something that is really just, it's a product of stress, and it would be under any other normal circumstance. We're just seeing it at a larger scale and again, really amplified.
I think that also adds to the stress because nobody knows what the new normal is, and by the time you adjust to a situation, something else erupts. Dr. Holman, is the brain fog common in post-traumatic stress disorder too?
You can get that, absolutely. I think it depends, as the previous speaker said, the amount of stress that a person is experiencing is going to contribute to the degree to which a person experiences the brain fog. And the brain fog itself is itself a stressor. If you can imagine being stressed out, not being able to function and concentrate the way one might want to, that can cause tremendous amount of stress. And so, it is something that would be, yes, common that you would see with post-traumatic stress disorder, although the issue with COVID is that COVID is very unlike previous stressors and many stressors that lead to post-traumatic stress disorder, because it is has acute punctuated stressors that we experience. For example, like if there's a death of a loved one in our network, and at the same time, as the previous speaker mentioned, it's ongoing. It has been a chronic, unfolding, protracted form of stress that has punctuated acute stressors, which makes it very different. And one of the things that I think has made it hard for people, and this is an area of research that I also study, is the distortion in our experience of time. We start to feel like we're not sure what day or time it is. We start to feel like maybe time's moving really slowly or moving really fast. And these distortions in time are also symptomatic of experiencing major trauma.
Dr. Lieberman, I understand that there are certain short-term and certain long-term mental health problems associated with the pandemic. So the question is, for how long after COVID can we expect these mental health issues to last, and what kind of time frame are we looking at? What problems, what symptoms?
We don't have good historical precedents to use to measure what the magnitude of the psychological traumatic effect is going to be and how long it will last. And that's because the whole discipline of disaster psychiatry, disaster mental health, has mainly occurred in the past 20, maximally 30 years, and it's usually studied events that were like earthquakes or hurricanes or tsunamis or even terrorist attacks. So these were traumatic events that were time limited, 1 day, 2 days, and also were geographically limited. This has been global for over a year. So the historical precedents are things like World War II, the Great Depression, the Spanish flu, and the data from those events is not that large. But if I were to speculate, I would say that we will see these effects enduring for years, meaning 5 to 10 years, and that for young people, children particularly, there will be a COVID generation, just like there was a generation that lived through the Great Depression. And the manifestations of that, we should be trying to determine and try to address preemptively before we wait for them to happen.
Sharon, Blady, there's talk of a tsunami of psychiatric problems post the pandemic. Should we then say that sleeplessness, panic attacks, anger issues, lack of interest in work, anxiety, all of these are part of our new normal?
Well, I wouldn't say they're necessarily part of our new normal, but we, I think, have been put in a position where we definitely have to address and confront them in ways that maybe our current healthcare systems have not been addressing. And I do think it's something where we have been prompted to make investments that may have been delayed or deferred otherwise. And I think this is one of those things that we need to consider. And as the previous speaker mentioned, that, we have to look at the fact that there are going to be different effects. They are going to affect individuals based on their experience. So in terms of their evolution in the long term, I do believe there are going to be multiple waves. It will impact the youth, and this is the opportunity for us to step in and make investments to try to minimize those things, but also to further longer term conversations, investments, and supports as they relate to mental health. We weren't given the opportunity to prepare for this, in terms of the scale, as much as there are, protocols in place for pandemics. This is at an unprecedented level. And as mentioned, we don't have the data. This is the time that we can start, based on what we do know, even if it is incomplete, start making those investments in prevention and care. So I think if there is a silver lining to draw from this pandemic, horrific pandemic cloud on a mental health level, then it is the opportunity to make investments so that we can mitigate what those waves will be. But it's going to be interesting to watch how this all unfolds and to try to speculate where we can go with making those investments so that folks don't have to suffer any more than they already have as a result of the situation.
Indeed. Dr. Holman, I understand it's different for different people. Everyone has their own threshold, their own coping mechanism. But when do you suggest COVID patients get back to their day-to-day work post-infection? Popular culture says that deep diving into work when trying to cope with a problem helps sometimes. But does this apply to mental health problems too? Or is it recommended that COVID patients take time off after testing negative, if they can?
This is something that's quite varied. It would work, not everybody, there's no cookie cutter response for anybody. And I think it's really, really important to remember that. Every individual has their own life story, and their own life story will impact how they respond to COVID. So in general, I think that it would be wise for people to pay attention to the degree to which they're feeling stressed, to the degree to which they're feeling brain fog, and to be able to make decisions about whether they're ready to take on full-time work or not. For some people, full-time work or even part-time work helps them cope, helps them address the problem. But for others, there may be more factors in their lives that are making it harder for them to cope. And I think one of the things that's really important is for the societal response to this to be open to and able to support the needs of different people with different coping abilities.
Dr. Klapow, what do you think should be an employer's role here? A lot of young people fear that poor mental health will affect their career growth and job prospects. So what can employers do? What can teams do to ensure that they make an employee recovering from COVID feel at ease?
Well, as all the speakers have said, we're trying to figure this out as we go forward. And particularly in the case of employers, trying to figure out return to work versus hybrid working versus giving individuals time off. I do think one of the most important things is to understand that the same mental health issues that have been there, whether it's the anxiety, the stress, the depression, the post-traumatic stress disorder, what you're going to see, as the other speakers have said, is greater volume of that. And so what employers have to put into place is, number one, better preparation to manage mental health problems, which may affect things like absenteeism or partial absenteeism, as well as create communications among employees that acknowledge and validate the use of mental health resources. It's a big problem. People are hesitant. They feel that sometimes that their job is in jeopardy. So, as all the speakers have said, these are issues that we have been dealing with at varying levels, but now the impact is much greater, the volume is much greater.
Dr. Lieberman, then what is your advice to the millions of people around the world who are recovering from the pandemic? What should they do to ensure their mental well-being? And how do they, first of all, start by identifying that there is a problem?
Well, everybody is going through a period of stress that's not pleasant, and it's normal to if you talk to somebody and you say, "Are you depressed? Are you anxious? Are you worried?" and they say no, then I would be worried about them because it's something that's just unprecedented and has been something we have had no control over. On the other hand, we know that there's going to be an aftermath. And the question is who's going to be affected by it and how bad is it going to be? And what will determine that is how what people's individual vulnerabilities are. So most people, I'll call them the worried well, are resilient enough so that they can use their common sense, follow good advice on public health, and get through this. If they lose their business, if they have no income, that's an added burden that has to be dealt with, but they'll get through. But individuals that have a pre-existing mental disorder, depression, anxiety, obsessive-compulsive disorder, substance abuse, they're at particular risk for having their symptoms exacerbated. Or individuals that have a pre-existing constitutional or genetic vulnerability, even if they haven't had a pre-existing condition, they may be vulnerable for this manifesting, and this can become severe and disabling. It can lead to self-medication with substances that can lead to addiction, or it can cause them to be self-harming and suicidal, or even domestic violence. Now, one last thing is that everybody's been saying we should prepare for this, and I particularly like the comments of Dr. Blady, who's a policymaker in the Canadian government. Everybody talks about it, but nobody's doing anything. There's no preemptive effort to try and mitigate the psychological consequences, which are going to cause some proportion of the population to have a disabling and distressing medical condition. I've been trying to get the United States to be more focused on this without success. I'm curious as to whether in Canada anything's being done.
Sharon, Blady, do you want to respond to that?
Yes, well, there have been things put in place here. So we have had everything from governments giving access to CBT courses online and free access to therapy, but it has varied over provincial governments. There have been things put in place by our federal government, including what were called economic response packages that involved biweekly and monthly payments, basically a stepping stone towards something like universal basic income. And I think that's the other part of this, is that while we are dealing with, a virus and then the pandemic implications of that on mental health, this is really about larger systemic investments. So it is about, we should be, if governments want to, facilitate recovery, it's about investing in people to ensure that they have a universal basic income, because financial stresses at a time like this are exacerbated. It's about investing in health care and social services, because again, those folks who are most vulnerable are even more vulnerable under this circumstance. So this has been an opportunity to see the cracks in the system and figure out what needs to be done. And I think this is, like I said, it's an opportunity that needs to be taken. And what we're seeing is that when governments make investments in their populations, that's when you see the greatest uptake and the greatest recovery in any circumstance. But the places that invested in things like universal basic income and other ways of ensuring that people did not encounter financial crisis had far better responses in both socioeconomically, but also in terms of political response and response to what governments do. This has been a time of insecurity where policymakers are in many respects making it up as they go along, trying to, follow the science, but the science is, half a step ahead of them at best. And so you're doing a lot of, for lack of a better way of putting it, policymakers are having to do educated guessing and hoping that they've got enough behind them to do these things properly.
Dr. Holman, this has to, I think, play out at various levels. I want to bring you in here because you've been a nursing professional. How do family and friends of COVID patients, what can they do? How can they help in their mental health recovery?
Well, I think what people can do to help their loved ones who have experienced COVID is to be very patient and very understanding and very compassionate in terms of just recognizing that there are challenges that the person is facing. One of the things that COVID has done is it has helped to undermine our sense of the future. And so helping a person rebuild the future by taking a small step at a time toward a new future that they can look forward to is a really important part of coping. Second thing that's really important, and this is true for everybody, if your loved one experienced COVID and you're experiencing it vicariously through that, one of the things that's really important, and this is something that we've established in our research for decades, that the overdoing media exposure, seeing too much media about the pandemic and becoming engaged in what some people call doom scrolling, is not good for your mental health. It's bad for your mental health. So if you have a loved one who has experienced COVID, but is spending a lot of time scrolling through social media or engaging in media stuff about it, try to encourage them to not do too much of that, because that can actually have a very negative impact on your mental health. We've established that through several disasters, 9/11, Boston Marathon bombing, Orlando nightclub shooting. We see the media can actually, too much media exposure about a particularly negative event can have a very negative impact on your mental health.
And then sometimes in the media, they have these constructive conversations as well. Just because I represent the media, I have to say it. Dr. Klapow, what is your advice to the patients and their families on how best to identify and then cope with this?
There's two factors. One, this truly is what we call a biopsychosocial approach or model, that there are biological factors that are contributing to this. There are psychological or psychiatric, but there are social as well, and they're all intertwined. So this is not necessarily someone developing a psychiatric disorder as a function of COVID directly, but it can be a function of downstream effects, loss of a job, loss of a loved one, difficulty in recovering, those things. And so understanding and being patient, not just with the mental health piece, but with the larger social issues that someone may be challenged with. The second thing is, and we know this from disaster mental health research, is individuals don't have to experience COVID directly, become infected, to develop these kinds of psychological, social, and psychiatric problems. The isolation, the doom scrolling, the lack of human interaction. Even if an individual hasn't developed COVID, they are still going to be at risk for very similar psychological issues.
Dr. Lieberman, the reason we are calling mental health a silent pandemic is because not many people are comfortable talking about stress or depression or anxiety. And those who talk about being disturbed are often branded crazy. So what's your message to various governments, to parents, to teachers, employers, everyone in our global audience? How can they destigmatize mental health?
Well, I think Dr. Blady was speaking to that with saying this is an opportunity to address the cracks in our system. And there's few bigger cracks in the system than the neglect and underfunding of mental health care. So one of the silver linings of the pandemic is the fact that it's bringing the issue of mental health and mental illness out into the public and forcing us to look at it. And make it okay to talk about it, because everybody's feeling bad because of what's happening. As to what impact that has in terms of, one, reducing stigma, or two, impelling governments or health systems to be more proactive in providing a better quality and a broader scope of mental health services, remains to be seen. The historical stigma and misunderstanding, discriminatory behaviors about mental illness have been very difficult to eliminate. In history, there have been many illnesses that have been associated with stigma and very, very negative perceptions. Leprosy, smallpox, cancer, tuberculosis, AIDS, HIV, but all of these have become sanitized in terms of science revealing what causes them, treatments being developed to manage them, and now it's okay. You can talk to Magic Johnson, who has AIDS, and know that he has AIDS, and you're not going to avoid him or think he's a leper. But mental illness has been much harder to eliminate the stigma of. And it may be because mental illness is something that affects not a part of your body so much as it is who you are as a person. But I'm hopeful that this will help in this gradual process of eliminating stigma. One other thing, Palki, to mention is that in terms of what people can do, there are many, many resources online at websites that have mental health first aid, educational information, or learning modules about how to help yourself manage, and then also have hotlines or phone numbers or websites to go to if you need to seek help from a mental health provider. And my advice to people is that when it comes to seeking help, if you think you need it, err on the side of caution. But in the interim, you can go online and there's a lot of information available.
Sharon, Blady, I know a lot of your work is centered on destigmatizing mental health, so I want to end with you very quickly. What's your message to our global audience on how they can put an end to this taboo associated with conversations on mental health?
Well, by talking about it. First of all, it's okay to not be okay. And I am someone that lives with multiple mental health and neurodiversity diagnoses. And when I was the Minister of Health for the province of Manitoba, I went public about that and I spoke about it, and I can tell that there were issues with folks in the building that maybe, you know, within the legislature that didn't want me to go public, but I believed it was an opportunity to lead by example. So I think we need to be having more conversations. I'm not saying that everyone has to tell their story, but I think there are those of us who we can use our story and our experience to let people know, to model the behavior, and to start to demonstrate to folks that you can achieve great things while living with a variety of diagnoses, and that a certain amount of our own recovery comes from self-compassion and self-empathy, and the understanding of others. So I would ask people to lead with compassion, empathy, and an open mind to those around us that do live with mental health issues, again, and that precede the pandemic. That's the best place that we're going to go forward, is with that mutual understanding and respect, and that's where stigma will come to an end.
Yes, and as you said, it begins with starting the conversation. We're going to end this session, but we believe and we hope that this will start some conversations. Ladies and gentlemen, thank you very much for taking time off your busy schedules and joining us for our third and final session of this virtual summit. And with that, we come to the end of this very special summit. I hope that we've been able to deliver on our promises. I hope that we've been able to answer some FAQs. And most importantly, I hope that we've been able to start a conversation, a larger conversation around mental health. I would once again like to thank all our dialogue partners and also thank you for joining us on this digital summit. We'll see you soon. Till then, stay safe. Take care of your mental health.